Hello, everyone. My name is Rahul Goyal. I'm the clinical executive with Elsevier Clinical Solutions. I'm a practicing GP and I work in the urgent care setting in the northwest of England. We have today with us Dr. Claire Mallinson. Hello, Claire. Please could you introduce yourselves to our guests?
Hello, my name is Claire Mallinson and I'm a consultant anaesthetist and Director of Education at King's Health Partners, which is an academic health science centre.
Tell us more about your work and your day-to-day. How does your work, your typical week look like? You have a lot of responsibility.
I'm really fortunate in that I am half-time clinical as a practicing anaesthetist, particularly in complex spinal deformity surgery in children and also complex endometrial surgery jointly with bowel and gynecological surgeons. And then the other half of my week is all to do with education, and I've spent an enormous amount of time in medical education as director of medical education and running at a national level, but now really interested in multi-professional education as healthcare changes, and that's my role in King's Health Partners, is to really look at how the workforce of tomorrow needs to be trained so that not only the people coming through but the people that we're all working with now and ourselves are adaptive to the environment that we're working in, so using all the technology, the personalised care that is now available, really understanding population health, and the other key strategy is digital and data and robotics in healthcare, which was not there when I went to medical school. So it's really important that everybody has these new opportunities, and those are our key themes in King's Health Partners education.
Thank you very much. That's interesting. So, right off the bat, trying to manage both the clinical practice and the medical education, both are heavy hitters in any scenario, especially within the NHS. Now, what would you think are the biggest workflow challenges you see healthcare professionals facing today on both the practice and the medical education side?
So it's such a crowded environment now, not just in terms of patient numbers, but the complexity of our patients, understanding the context of healthcare within the social environment, and of course our workforce have been through so much that to really engage with the workforce to work at the top of their game is super important. And as much as there's been unrest and pay disputes, we've also got to look at the non-pay benefits of really good education, really supporting people to be at the top of their game and to be performing in their zone of comfort, making sure that they're not just competent but confident in the care that they're delivering to our patients. So it's something where we have really got to look at the education environment of the NHS and making sure that every moment counts in terms of every time there's an opportunity to learn, that it's there for people, and the times of people being able to go off to do classroom teaching has changed, and that classroom teaching is not always what is needed for the education needs of all of our teams. So, of course, time is of the essence, people's confidence and capabilities in new technologies, and also to ensure that patient flows are enabled by using technology, so as to make sure that our healthcare workers are with patients at the bedside, by them in clinic, and really engage in that one-to-one time, which is so important, has always been important and remains really fundamental to delivering the best practice.
Thanks, Claire. And you're a well-recognized leader in developing specialized surgical programs and medical education initiatives. And how do you see AI and generative AI and these new technologies transforming these areas of healthcare within the NHS?
Well, it's odd, isn't it, that we're supposedly scientists and working at the, kind of latest technology, and yet in healthcare we seem to be lagging behind what we've got used to in our lives. We're used to doing our banking on our apps, we're used to doing our shopping on the apps, and yet we come into healthcare and it feels as if we've got to work in an archaic way. And, as new technologies come along, we need to embrace them to really ensure that we capture the changes that can be there, and to stop being resistant to that. Of course, people are very unsure about where technology will overtake their roles, or maybe overtake, things that they've always been held in high regard for. But there's so much work now that we have to really look at who is delivering the care, and at what point does it really need to be that person-to-person time. And using AI and technology can really take away some of the admin burden that is occurring in our organisations. And instead of typing in the keyboards, we should be really analysing the data of all that's been entered into our computers. So it's not that AI is going to take over the world, but the people that use it will. And that's the same in healthcare. And we don't want people to be telling us what the solutions are to things that maybe aren't even a problem. So we've got to be co-owners in the development of data and AI, so that we can work with programmers, we can work with so many other people in other faculties, so that we can deliver AI and data technology with us in mind and our patients, so that it enables us. When electricity was discovered, people were just excited about putting lights in their hallways, and they didn't think about streaming and Netflix and TVs and pixels. But likewise, we should really look at using AI to enable the work that we already do, and not try and look too much into what it's going to take over. And we have to be the curators of that journey. There's so many problems in not just the NHS, but all healthcare systems, to really ensure that our productivity, our long-term plans, and the way we transform the NHS and healthcare around the world is what the patients want, and that the workforce is ready to support and deliver that.
Thanks. And I think one of the things that comes to mind when you're talking about healthcare being kind of a laggard, on technology is a few years ago, I'm not going to say how many, it'll reveal my age, I was in a queue going through an airport, and I forgot my bleep in my pocket. I was just coming off shift, and I put the bleep out, and the guy who was sort of patting me down said, "Oh, I'm an ex-fireman, and are you a doctor?" I said, "How do you know?" He said, "You are the only guys using a bleep nowadays. We stopped using it 10 years ago." And that sort of brings to mind how technology, for right reasons at times, but I think us being laggards is no more an option. We have to be part of the story, part of the journey of AI and Gen AI, and harness it for best quality care for our patients, and make our healthcare and provision more sustainable, essentially. Claire, you work regularly with complex surgical cases, like you just said, and it's a very niche field. And you also train others in the field, and thank you for that. Could you share specific examples of where you see AI and generative AI supporting, the most important last mile, which is the decision making, and also the learning in challenging clinical scenarios that you've come across?
Yes, so in my specific field, and where I come across children with complex genetic disorders, and we have to look at their syndromes and how that's going to make a difference to their physiology, their pharmacology, and the monitoring. And by using AI, we can really look into, those areas that you don't, it's not straight away in your head. You know what you've learnt at medical school and through your clinical practice, but it's lovely to now have the knowledge at our fingertips to really sense check, not to look up from the beginning, but to sense check, is there something I've missed? So you can look at, well, does this mean a difference with this drug or the medication, the post-op care? And so by using technology, and instead of going through loads and loads of PubMed and journals and that taking almost longer than the case itself, it's really useful to use AI, but in a system that is discrete and is not going to be making facts up like some of the generative AI tools already do. So it's really super useful to use AI on edited material. What we don't want is situations where we're using technology and we do not understand the sources of the data that's going into it to make those decisions. And that enables us. So all it's doing is speeding up what we already do and enabling us. So it's like having another colleague at your side so that you can make those decisions. And to read, articles and abstracts and journal papers and letters on where other people have had experiences, and to do that in a timely manner is really good. And also supervising, I had a young colleague who's doing his master's and looking up, kind of good articles to base their work on what their project work's going to be. And that we can do that now in a couple of hours, what used to take a couple of weeks. So it's about using our time in a much more useful way. So that is always really, really helpful in those situations.